Assalamu alaikum. Today our topic is about bovine ephemeral fever. The bovine ephemeral fever is also known as the 3-day sickness (TDS) and bovine enzootic fever, bovine influenza, or stiff sickness, an insect transmitted non-contagious viral disease of cattle and water buffalo. An apparent infection can develop in cattle, buffalo, beast, buck, and deer, and possibly goats. Coming toward the etiology of this disease, it is associated with an arthropod borne rhabdovirus, that is, the type species of the genus Ephemeral virus. The number of strains of this genus vary antigenically. The other antigenically related but non-pathogenic species of ephemeral virus occur in the same environment in Australia. The BEF virus is closely associated with the leukocyte platelet fraction of the blood. It can be maintained deep frozen or on tissue culture and chick embryos. Coming toward the epidemiology, the enzootic in tropical area, the disease present as episodic epidemic in the areas. Outbreaks can last several months with the spread of infection following the prevailing winds. The morbidity rate in outbreaks is usually between 25% to 45%. High susceptible population and highly virulent virus strain, then the morbidity rate may reach up to 100%. A rate of 1% for case fatality and but can approach 10% in highly virulent strains. The disease occurs in the summer month and outbreaks are clustered and relatively short-lived, and the spread depends largely on the insect vector population and the force and direction of the prevailing winds. So the transmission is through the biological vector, and clinically infected animal is the source of the infection. Transmission by mosquitoes and the biting midges and spread by wind-borne carriage of vectors has been documented. Transboundary movement can occur by animal transport, and transmission does not occur through the contact with the infected animals or their saliva or ocular discharge through the semen or intrauterine administration of virus. And the cattle serves as a reservoir host. So the pathogenesis of this disease is virus multiplication occur primarily within the vascular system, and from there the alteration of the cellular biology, and then enhancement of virus entry and replication by the activation of intracellular signal pathway, and then upregulation of clethrine and dynamine 2 expression and activation of COX2 mediated E prostanoid receptors 2 and 4, and then enhancement of clethrine mediated endocytosis of the virus, and then generalized inflammation with vasculitis and thrombosis, serofibrinosis, inflammation in serous and synovial cavities, and increased endothelial permeability at the same sites. The risk factors are environment related, And disease occur in the summer month, and outbreaks are clustered and relatively short-lived. The spread depends largely on the insect vector population and the force and direction of the prevailing wind. Recurrence depends primarily on suitable environmental conditions for increased and dissemination of the insect vector and the degree of the population immunity. Then it is also the animal related. Cattle is naturally affected. All age groups of the cattle are susceptible. Calves less than 3 to 6 months old are not affected by the natural disease. In dairy cattle, higher producing cows are at greater risk, and clinical disease may be minimal in cow under 2 years of age. No breed susceptible in natural outbreaks. Coming toward the economic importance, although the case fertility rate is very low and considerable loss occur in dairy herds as a result of the depression of milk flow up to 80% in the cow in late lactation, and the highest yielding cows having the greatest drop. So following the recovery from the disease, milk production remain still less than that of the pre-infection levels. Decreased resistance of to mastitis and delay in occurrence of estrus, abortion in cows, and temporary sterility in bulls. Now coming toward the clinical signs, the calves are least affected with that are less than the age of 3 to 6 months and show no clinical signs. Then overweight cows, high producing cows, and bulls are affected the most. Incubation period of this disease is 2 to 4 days, and the sudden onset of fever, which goes till 105 to 106 Fahrenheit. Fever may be biphasic or have morning remission. Anorexia and sharp fall in milk yield, severe constipation in some animals, and diarrhea in others. Increased respiratory and cardiac rates, strangely nasal and watery ocular discharge, constant head shaking, muscle shivering, and weakness. There may be swelling about the shoulder, neck, and back region. Muscular signs become more evident on the second day with severe stiffness, clonic muscle movement, and weakness in one or more limbs. Posture similar to the acute laminitis with all 4 feet bunched under the body often adopted. Animal begin eating and on third day and the febrile reaction disappears. Lameness and weakness may persist for 2 to 3 days. And common name of 3 day sickness is app- applied because animals typically progress through onset of disease to severe illness and recovery within 3 days. Occasionally, animal adopt a posture of lateral recumbency. Same develop clinically detectable pulmonary and subcutaneous emphysema, possibly related to the nutritional deficiency of selenium. Then, some cases have a second episode of clinical disease 2 to 3 weeks after the recovery. Occasional cases show persistent recumbency and have to be destroyed. Abortion occur in small proportion of cases. Affected bulls are temporarily sterile, and milder cases with clinical signs restricted to the pyrexia and lack of appetite may occur at the end of the episode. So here the heifer with bovine ephemeral fever virus unable of bearing the weight on the hindlings. Cow with bovine ephemeral fever, depressed, lamed, and has stringy nasal discharge. And here you can see the recumbency. Here is also the nasal discharge and the drawing of the saliva and the sternal recumbency, just like that of the hypocalcemia or the milk fever. A cow shows lateral recumbency and emphysematous swelling in the shoulder, neck, and back region. Now, coming toward the postmortem findings of this 3-day sickness, the most consistent lesion are serofibrinous polyserositis involving the synovial and pericardial, pleural, and peritoneal cavities. Pulmonary emphysema and fibrinous bronchiolitis are standard finding. Subcutaneous emphysema along the dorsum may be observed. Hemorrhage may also be observed in the particular tissue. Focal necrosis in the musculature of the limbs and back. All lymph nodes are usually enlarged and edematous. A mild vasculitis of small vessels with perivascular neutrophils and edema fluid plus intravascular fibrin thrombi can be found in this postmortem. Coming to the diagnosis, so first of all, the clinical signs and then postmortem lesions of the died animal, then virology of lung, spleen, and the synovial membrane of the pericardium for virus isolation. And so in the serology, we can go for the ELISA from the pericardial fluid, and for the histopathology, formalin fixed sample of the previously mentioned tissues in the postmortem lesions. For differential diagnosis, the clinical presentation is good enough, but we differentiate it from the botulism, Partusian paresis, pneumonia, and traumatic reticulitis. Coming toward the treatment of this, we go with the non-steroidal anti-inflammatory drugs like loxin through IV or IM route, and ketoprofen, and then phenylbutazone. And we can go with the calcium borogluconate. Coming toward the control and prevention, restriction of movement from infected areas, vaccination of the affected method of control. Control, the main control is the restriction of the animal movement which is infected, and then vaccination is another effective method of control. There are two types of vaccination are required, effective in preventing disease in natural outbreaks for periods up to 12 months. Vaccination prepared from the attenuated tissue culture virus, and back mutation of the attenuated strain to a virulent form is seen. The use of inactivated vaccine therefore offer an attractive alternative, such as formalin killed vaccine. An inactivated vaccine require at least 3 vaccination to provide long-term immunity. And another control is through the control of the vector population. So this was all. Thank you so much. If you have any question, you can ask.